AIDA with a speech about medicine of Kazakhstan. What was the first association that arose in your minds with this phrase? Not the best use, I suppose. Let me ask another question. Imagine that doctors found that you are badly ill, for example, cancer. What country would you trust to treat yourself? For my great regret and disappointment, you probably will not choose Kazakhstan, because our healthcare system is not the best. Actually, World Health Organization in 2000 rated the efficiency of Kazakhstan's healthcare system as a 64. 64. Kazakhstan has a universal coverage system, which is not effective as we see. Obviously, this system should be changed, and the alternative to this system is the obligatory insurance. I am persuading you today that Kazakhstan needs the system of obligatory insurance. I will briefly explain what is the universal coverage system, the obligatory insurance, and provide arguments supporting my position. Universal coverage system is so-called free medicine, meaning that all medicine is free and available to everyone. It is supposed that countries who have this universal coverage system, they should have infinite funding, infinite financing of such system in order to provide free medicine to everyone. According to the annual report of Kazakhstan's Ministry of Health, Kazakhstan's health expenditure is only 4.5% of GDP. It is one of the lowest shares in the European region of the World Health Organization. And the obligatory insurance, where you should pay to medical services every month or every year. Or another option is when your employer pays instead of you, when your employer provides you medical insurance, like our university does. Nazarbayev University provides medical insurance to their employees and to the students. So, going to the arguments. The first one, obligatory insurance will provide stabilized fund for medicine. It means that our medicine will have better buildings, better equipment, and higher salaries for our doctors who are suffering from low salaries and high responsibilities. All these factors will lead to better quality of our medicine. The second argument is that obligatory insurance will clear the current structure of healthcare system. As I said, we have so-called free medicine, which should include free treatments and free drugs. But do you agree with me if I will say that we are paying for some treatments and for some drugs? And the obligatory insurance will clear this, because everything will be already paid. The third argument is that obligatory insurance will induce persons to take more accurate care of themselves through the regular, already paid check-ups. In this fashion, you will always know the state of your health, and if you are not satisfied with this state, you will do something to get well. Maybe you will do more sports or do less smoking and drinking alcohol. Unfortunately, our regular citizen has two states of health. He is totally healthy, and he is almost dead, disabled, or under the insult. Why it is so? Because he is not regularly checked up. Because a lot of reasons. The fourth argument is against the universal coverage system, which allows to take free medicine only in the places you are registered, only in the hospitals you are registered, except of the first aid help. I mean that first aid help can be obtained everywhere, in every city of our country, but regular medical help can be obtained only in your city, or in the hospitals where you are registered. Additionally, you should probably notice a gap between the quality of medical services between regions and cities like Astana and Almaty. Why am I because regions are not appropriately funded. I want my grandparents to be safe and under the medical control at home. And I want me to be safe at my home near my grandchildren. And also, in order to obtain those medical care, our grandparents need to stay in the queues. I mean, hospital queues and the queues for quotas. The latest queues can last for years. They are old. They don't have extra years to wait for the medical help. And obligatory insurance will destroy these queues. So, do you agree that obligatory insurance will provide better medical conditions to our nation? And did I persuade you that Kazakhstan needs obligatory insurance? If yes, I am satisfied with my speech. God bless you and God bless